Assalamualaikum and a very good day for everyone. I'm Siti Nurhana with Nur Fatiha as the representative of Group 3. I'm really glad to present our group presentation with the topic of oocyte aging. Here's the content that we're gonna explain in detail. Life is the most amazing gift and the earth has given, and the beginning of all life is the constant development of the oocyte. Oocyte development from embryonic to mature requires the cultivation of ovarian tissue. It can take up to 14 days to grow, and ovarian tissue is made up of cortex and medulla. Ovulation is growth process of a primary egg cell into a mature egg cell. At birth, a woman has up to 1 million eggs in her ovaries, but only 300 to 400 of them will mature enough to ovulate during her lifetime. Follicular formation of the process of follicular development, beginning with primordia and ending with ovulation or follicular atresia. Normal aging of human body, diet, disease associated with oocyte senescence, and modern environmental pollutants all affect longevity of female oocyte.
Ovarian tissue consists of two compartments, which are cortex and medulla. Medulla is the inner compartment. It contains connective tissue, fibrous tissue, and blood vessels. Cortex is the peripheral compartment. It contains ovarian follicles at different stages of maturation. Each follicle contains an oocyte surrounded by a layer of follicular cells. As the oocyte proliferates and matures, the layer of follicular cells will also increase. The additional layers of follicular cells are known as granulosa cells. Oogenesis is a growth process in which the primary egg cell becomes a mature ovum. At the 7 weeks of gestation, primordial germ cells in the female embryo begin oogenesis. At 20 weeks of gestation, each fetal oogonium develops into primary oocytes, and then it remains arrested in process 1 of meiosis until puberty. Before ovulation stage, luteinizing hormone induces the first meiotic division of the oocyte to continue. As a result, 2 cells are produced, which are the secondary oocyte and polar body. Secondary oocytes will undergo meiosis 2 and remain arrested in metaphase 2. The remaining process will be complete after fertilization. At 28 weeks of gestation, follicular atresia starts. At birth, there are only 1 million oocytes present in the ovary. Atresia will continue throughout adult life, and only 300 to 400 oocytes will reach the ovulation stage. Folliculogenesis is the development process of ovarian follicles starting at primordial follicles and ending with either ovulation or follicular atresia. Beginning from 15 weeks of gestation, the primordial follicles develop and mature until oocytes reach prophase 1. Primordial follicles mature to primary, secondary, preantral to antral. During puberty, gonadotropins are secreted by pituitary gland, which is used to promote the development of antral follicles to pre-ovulatory Graafian follicles. During the early stage of maturation, follicle-stimulating hormone is produced. During this late stage, both FSH and LH are produced. All these hormones affect the follicles by allowing it to enlarge and develop into anthra, which contain follicular fluid. After that, one set of selected follicles will become dominant, while the rest will undergo follicular atresia.
Aging is one of the factors that affect oocyte longevity. Factors of oocyte senescence, which is caused by women's aging, can be divided into 2 types: acellular factors and cellular factors. Acellular factors include oxidative stress, hormonal changes, and alters in function of microRNA, which occur when women face aging. On the other hand, cellular factors are closely related to the mechanisms of cumulus cells. Okay, first I will explain what is cumulus cell is and how cumulus cells are related to oocyte aging. Cumulus cells, OCCs, are functional cells that originate from undifferentiated granulosa cells. Cumulus cells have highly specialized cytoplasmic projection that pass through the zona pellucida to form a gap junction with the oocyte. The cumulus cells surround the oocyte to form the cumulus oocyte complex, OCOC. COC plays an important role in the development of healthy embryos, as it provides the essential nutrients for oocyte development. Move to the next question. How can male cells contribute to oocyte aging? First, CCs cause oocyte aging via activation of FAS or FAS-L pathway. FAS stands as fast cell surface death receptor, while FAS-L refers to fast ligand. The interaction of these two molecules lead to the apoptosis, where the death of different cell types will be induced. Aging oocytes have been found to be surrounded by CCs that secrete as FAS-L soluble form of FAS-L. Thus, as FAS-L secretion is believed to be the mechanism by which CCs accelerate the oocyte aging. Second, the death rate of oocytes is highly related with the ceramic level and mitochondrial activities as inhibited by CCs. This situation occurs because ceramide, which is a bioactive lipid produced by CCs, is transported to oocytes via gap junctions. The high level of ceramide in cytosol of oocytes leads to higher apoptotic rates of the aged oocytes. To add on, the decrease of mitochondrial ceramide levels can cause mitochondrial dysfunction. Mitochondria are essential as they take part in cellular energy production and normal spindle formation. In brief, during aging, disruptions in intracellular ceramide synthesis and transport cause abnormal mitochondrial and cytosolic ceramide levels in oocytes. This ceramide imbalance negatively impacts the functionality of oocyte mitochondria and the oocyte quality. Next, let us discuss the factors that affect oocyte longevity through aging. Maternal age is highly associated with the compromised functions of cumulus cells that will result in epigenetic modification and altered miRNA functions in aged oocytes. You probably wonder, is miRNA? Generally, miRNA are small non-coding RNAs that bind to target messenger mRNAs to inhibit their expression. mRNAs exist freely or enclosed in vesicles in the human follicular fluid to enable CCs and the adjacent oocytes to regulate oocytes DNA methylation. So when someone ages, the follicular environment and its protein composition will naturally be affected. Now, let us see some miRNAs that are related to aging. Firstly, MIR190B level increases with aging, and this miRNA is important as it targets exostosin 1. Exostosin is a protein found in Golgi apparatus which modifies newly produced enzymes and other proteins. Because of these changes, follicle morphogenesis deregulate and abnormal glucose metabolism is detected in follicles of older women. Aging is also associated with decreased levels of MIR215P, which targets several genes that are important in p53 pathway and plays a crucial role in the aging process. Other miRNAs level are also affected because of aging, such as higher level of MIR134 and lower expression of MIR132. Not only mRNAs, hormones are also affected during aging that affect oocytes longevity. By time, the functions of gonadotropin releasing hormones such as GnRH, FSH, and LH are compromised. So initially, what do these hormones do? GnRH is master hormone that is secreted by the hypothalamus and regulates the release of gonadotropins such as FSH and LH from the anterior pituitary gland. LH stimulates TK cells to produce androstenedione, while FSH stimulates the conversion of the TK-derived androstenedione to estradiol. In addition to the synthesis of inhibin by the GCs in small antral follicles. There are studies that have demonstrated a decline in gonadotropin levels, especially LH, in postmenopausal women, most likely due to the changes in hypothalamic GnRH stimulation. Reduced levels of serum gonadotropin-free alpha subunit, or we call it as FAS, and LH as neuroendocrine markers of possible GnRH secretion were reported in group of postmenopausal women compared with their younger peers.
Next, diet can affect the oocyte aging. Poor diet is also one of the significant causes for oxidative stress, mitochondrial dysfunction, and oocyte aging. Antioxidants are crucial in maintaining ovarian function and fertility. Oxidative stress happens when the production of ROS and the scavenging effects of the antioxidants become imbalanced. Thus, by including food containing antioxidants, it will help in decreasing ROS-mediated oocyte damage and preserve the quality of aging oocytes and follicles. This has been proven in the application of antioxidant NSC to oocyte culture. DNA damage and chromosomal instability in oocytes were believed to be reduced in this application. Next, melatonin is a hormone that is produced naturally by the body and has antioxidant properties. Long-term melatonin treatment improves ovarian mitochondrial oxidative damage. It protects the ovarian tissue from aging by decreasing mitochondrial ROS generation, inhibiting apoptosis, suppressing the collapse of mitochondrial membrane potential, and maintaining respiratory chain complex activities. This hormone also has been shown to be twice as effective as vitamin E. Older females can decrease oocyte ROS by decreasing their caloric intake. In older females, caloric helps to preserve oocyte quality. The level of coenzyme Q10 production essential in fertility. Aged oocytes will have low levels of this coenzyme, which leads to low ATP production and increase of spindle abnormalities. Moreover, being obese has negative effects on oocyte aging. When a woman is obese, the level of intrafollicular insulin, triglyceride, and lipoprotein receptors, as well as inflammatory markers such as C-reactive protein, will increase in their body compared to a woman of normal weight. In addition, the level of leptin also will increase in the blood and follicular fluid of obese women. Research has been done on female rats that have dietary-induced obesity and hyperleptinemia. It is proven that the reproduction rate of those obese female rats were decreased by 60%. Hyperlipidemia in obese women leads to oxidative stress in the endoplasmic reticulum as well as to the production of ROS, resulting in mitochondrial dysfunction and aging. Hence, weight control has become an important contributing factor to preserve fertility in women.
A disease that is associated with oocyte growth and maturation is polycystic ovary syndrome, or we call it as PCOS. PCOS is a hormonal disorder that is common among women of reproductive age. Now, I will explain the symptoms, causes, and complications of polycystic ovary disorder. Alright, there are few symptoms related to PCOS, which are irregular periods, excess androgen, and polycystic ovaries. PCOS can be identified by having infrequent, irregular, and prolonged menstrual cycles due to hormonal imbalance. For example, the patient might have fewer than 9 periods a year, more than 35 days between periods, and abnormally heavy periods. Next is excess androgen. Androgen is the male hormone, and the elevated levels of this hormone will result in physical changes such as excess facial and body hair, or we call it as hirsutism, occasionally severe acne, and male pattern baldness. Finally, polycystic ovaries. Ovaries will enlarge and contain follicles that will surround the eggs. This situation could lead to the failure of ovaries to function regularly. Polycystic ovary syndrome is caused by several factors, which are the excess of insulin, chronic low-grade inflammation, and the excess of androgen hormone. Firstly, the high production of insulin can interrupt the ovulation process and also can lead to the production of excess testosterone by the ovaries. Next, this syndrome also can be caused by chronic low-grade inflammation. The inflammation can stimulate the polycystic ovaries to produce androgen, then that will contribute to the accumulation of visceral fat. The accumulation of visceral fat would lead to ovarian dysfunction and hyperandrogenism, which can lead to heart and blood vessel problems. And lastly, the excess androgen production, which is caused by the disruption of normal ovarian or adrenal function that drive impaired follicular genesis. Polycystic ovary syndrome can give rise to several complications towards the patients. Firstly, PCOS can cause infertility. PCOS can affect the balance of hormones that then will interfere with the ovulation process. If the ovules are not released from the ovaries, then the fertilization process cannot occur. Thus, no pregnancies could happen. Secondly, because also can cause to miscarriage or premature birth. This is due to the endometrial dysfunction that affects the implantation rate, insulin resistance, and high level of adipose tissue. The endometrial dysfunction also could lead to abnormal uterine bleeding, and lastly, PCOS can cause non-alcohol steatohepatitis, and non-alcohol steatohepatitis is liver inflammation and damage caused by the inflammation of fat in the liver. PCOS causes an increasing level of androgen, and the overproduction of androgen can lead to an androgen-dependent pro-apoptotic. This because environment that can contribute to liver disease progression.
Environment pollutant also can affect oocyte aging. One of the environmental pollutants that we can find on a daily basis that affects oocyte aging is pesticide. So the lack of precautions and daily exposure of pesticides towards women can cause fertility problems. Different types and levels of toxicity have been shown to disrupt female hormones and cause dysregulation of the ovarian cycle. So now, how can we expose to pesticides? Well, there are a few ways, which is first, by consuming pesticide-less fruits and vegetables. Secondly, by drinking water contaminated with pesticides. Thirdly, while using household and gardening supplies, and lastly, while using some cosmetic and cleaning substances. Next is the effect of pesticides toward the hormonal functions in women. Daily exposure of pesticides have been proved by research to cause disruption in the menstrual cycle, fertility reduction, conception failure, which means having trouble getting pregnant, stillbirth, which indicates the death or loss of baby before or during delivery, spontaneous abortions or miscarriage, and lastly, developmental defects of the baby. In conclusion, aging, diet, disease associated with oocyte aging, and environmental pollutant can affect the oocyte aging. The aim of this review is to shed light on the risk factors for oocyte aging with the aim of developing new therapeutics that enhance the quality of oocytes and hence the quality of female life. For the sake of maintaining oocyte quality, a healthy lifestyle is crucial. That's all from us. Thank you.